Welcome to Brain Health Matters, a series of courses, programs, and shows just like this, all designed to help you become healthier so your brain can become happier and stronger. This week, you'll learn how chronic pain can be a danger to our central nervous system. And guess what? That includes the brain. Stay tuned.
Brain Health Matters is brought to you by The Musical Brain, Book 3 in the Healthy Brain series. Enjoy the fun and easy practices in this book to improve your memory, sharpen focus, and master your mind with the healing power of music. Available on Amazon everywhere.
I'm Kate Kunkle, your host, and this week we have Alissa Wolfe. She helps people beat chronic pain by retraining the nervous system with strategies based on neuroscience. She's a doctor of physical therapy and chronic pain who got out of the clinical setting to better help people with their pain. Welcome, Alissa.
Thank you so much. I'm really happy to be here. This is going to be a really fun and interesting talk.
Yes, I don't get a chance to talk to people in the neuroscience field very often, so this is very exciting for me as well.
Yes, and it's interesting to be almost associated, like you said, with the neuroscience field because when you think about physical therapy, we don't think that that has anything to do with neuroscience. And I'll be to admit it, like I didn't learn the neuroscience of pain in PT school. It was something that kind of had to learn on my own. So yeah, it's very interesting.
If you deal with people like with strokes and so forth, I used to work with a lot of people with strokes when I was actively doing vibroacoustic therapy, and I could see so much connection. The neuroscience, the pain, the rehabilitation, such an incredible dance of activities to make things happen.
Yeah, and that's exactly why, like I noticed that as well when I was practicing as a PT. And it was like the writing was on the wall to me, clear, obvious messages of like, if we're not doing anything for this nervous system, then these exercises that we're doing are kind of just a waste of time almost. So I had to kind of separate myself away from doing traditional, conventional physical therapy and now look at pain on from a completely different lens. So
you know what? I would like to see more people look at that because it's like, oh, I injured my arm, so the pain is from my arm, and that's all I have to deal with. I have to fix this arm. But what else is going on there?
Yeah, that is so yes, what is going on there? So I can talk about that if you'd like. Basically, yeah, we traditionally will like kind of look at, if you use the elbow, for example, my elbow hurts, I can point to it, I can feel it, it's right there. I can touch the pain. I can manipulate it. If I move my elbow, it hurts more, that kind of thing. It makes sense that maybe there's a structural issue in the elbow. Maybe there's a weak muscle. Maybe there's a nerve getting irritated down there. The problem is there's a whole messaging system that's connecting that elbow to the brain. And I think we often, like we said, we perceive the pain as in the elbow. It's coming from the elbow and our brain is receiving the pain message, but really that's not what's going on. The brain receives more or less a danger message or some other piece of information. And then the brain can create pain as an output, depending on how it decides if you're safe or not. Is the elbow safe? Maybe it's not. So then if it's not safe, it's going to decide, well, you should probably know about this, and it's going to alert you by giving you that sensation of pain. So pain doesn't exist until the brain gets involved. Now, the thing that's funky about pain is that when it exists for a long period of time, things start to change in our nervous system. So some of the long-term effects of pain, it affects not just the brain, because I think when we say nervous system, we oftentimes just think brain. It also affects our peripheral nerve. So that nerve connecting from the elbow to the spinal cord can actually undergo some changes, making it more sensitive to different stimuli. So it might start sending a danger message in an event of, say, let's say changes in temperature. It might start send a message when you have an immune response or when you have a lot more stress. So that can amplify the pain, but you still feel it the same way as if you bumped your elbow. It's the same pain, but there's a different stimulus there. So the peripheral nerves can change. The spinal cord itself can change. And basically, one of the main roles of the spinal cord is to actually prevent some of those messages from going up to the brain. So the brain constantly isn't hearing a bunch of noise. For example, if the spinal cord didn't do its job, your brain would be hearing all the time, you're wearing pants, you're wearing pants, you're wearing pants, you're wearing pants. And that's just useless to the brain. And it's a bunch of noise, and the brain would then have to deal with that. And it would be a lot more challenging, right?
It's like when you put a watch on, you feel it at first, but then you don't feel it after that.
Goes away. Yeah, exactly. And when you think about it again, oh yeah, I'm wearing that watch, I can feel it. Same idea. But that's the spinal cord's level of like, I'm going to filter out some of this information because it's not nearly as important. If you bump your elbow, that spinal cord's going to let that message go up because that's important. But that spinal cord can change, and it can allow more of those messages to start getting up to the brain. And so that then can also amplify pain, because then the brain is getting more of those danger messages.
So you were talking about the fight or flight. So that's where the danger messages come in. By the way, folks, Alissa and I are together on the Gluten-Free Lifestyle Summit. And when I saw her, I just had to invite her here. But she talks a lot about the fight or flight. So is that where that's coming in on the spinal cord then?
Not necessarily, no. So the reason that spinal cord changes is actually as a result of, so that danger message, what is actually happening there when that, let's say the elbow nerve sends a message to the spinal cord, it's releasing a chemical, an amino acid, into the spinal cord. It's a neurotransmitter. And that amino acid in high amounts over a long period of time can actually cause, and this is going to sound really bad to anyone listening, but it actually causes death to a very important nerve in the spinal cord, which acts as the gatekeeper. It decides when to send that message or not. And so when that gatekeeper dies, that message just gets passed along. And yeah, I know I don't like talking about this because it's really sad and scary.
Yeah, but people need to understand. So if they find perhaps now that they're so sensitive to so many things, so that they might not have even noticed before, that could be why. And that's important because overloading the brain is really bad for everything, but especially for your long-term cognitive health, because the brain can only handle so much stress. And that's a kind of stress, right?
Yeah, exactly. Which kind of ties back into that idea of the fight or flight response. And so like on a brain level, there's a couple of things kind of going on, is that the fight or flight response is essentially a protective mechanism, and pain is also a protective mechanism. So those two things, and fear, all three of those things kind of activate together at the same time: pain, fear, fight or flight. So as a protective response, your body is going to activate that fight or flight response as a means to protect you. It's another one of the outputs the body will use to protect you in a survival situation. So some other, besides activating pain and anxiety as kind of our alarms to let you know, hey, something could be wrong, it's going to, that fight or flight response is also going to, we talked about this in the Gluten-Free Summit, but it's also going to kind of shut down our GI system, our ability to digest, because in a survival situation, if a lion is chasing you, for example, it's not going to be great for your survival to digest a sandwich. Those resources and that energy is going to be better used somewhere else, like running away, right? That's the number one goal, is survival. So it's going to shut off or turn those resources away from the digestive system and use them for survival purposes. Same thing goes with the reproductive system. It's going to kind of turn off that system momentarily in order to allow you to survive. So a lot of times with chronic pain, we see unusual menstrual cycles. We see really painful menstrual cycles. We see difficulty with libido. I could name a long list of other side effects and stuff like that, but that's a big one.
Sure. Yeah, because it's not important for you to have a good reproductive system right then. You're running, or you're dealing with pain.
You can't reproduce if you're dead, or if you're like, I mean, it sounds morbid, but like that's how the brain is thinking. It's very animalistic. It's very like I need to survive, and I can't reproduce if I don't survive this situation. So I'm going to put that on hold right now until I know I'm safe. And so that's, yeah, go ahead.
So that's why so many people who have digestive issues, whether it's lactose intolerance or gluten-free or any number of problems with digestion, they are also, because then that pain comes up, and then it's like, no, we can't reproduce. We're not going to be able to do this because we've got other things to deal with, even though those things might not actually have anything to do with the reproductive system.
Right, right. And it may, the way that I look at it is that fight or flight response can cause some of these other conditions in the reproductive system or the gut. So you may develop a food insensitivity. So gluten, for example, a lot of people with pain go gluten-free, or dairy-free, or, eat an anti-inflammatory diet. That may not solve their entire problem if that fight or flight stuff is kind of the core of the problem. It can help those symptoms kind of improve, but it may not resolve everything, because if that bigger problem is kind of going on. Same thing with the reproductive system for folks who have, say, endometriosis. That can be a contributing factor as to why did that develop in the first place, possibly. Now, there's always genetics as well, but
yeah, sure.
Yeah.
So where does stress, just pure like stress, ongoing stress, maybe financial stress, maybe, how does that fit into the chronic pain world?
So good. I love that question, because I think the answer is twofold, and hopefully I can do justice to answering that question. Stress, long-term stress. When we think about stress, I like to think of it from it's a chemical, not a like figure of our imagination. Like, it's not just a feeling, it's actually a chemical. It's cortisol in our bodies. And cortisol can cause our nerves, those peripheral nerves and our central nervous system nerves, to become more reactive. So the way that I like to explain this is, imagine if any nerve is just kind of sitting there at rest. In order for that nerve to fire or send a message, send a danger message, it has to reach a threshold. And let's just say, for simplicity, that threshold is 10, just a generic number. And it can detect lots of different stimuli. So it can detect blood supply, it can detect temperature, it can detect immune system changes, movement, pressure, vibration, and it can detect stress as well. So if your nerve is humming along at rest, kind of fluctuating around, let's say a 3 or a 2, just kind of humming along, and then stress comes up, a big stressful event comes up, that stress is going to increase that baseline closer to the threshold. So now you may be hanging out at about, let's say, an 8. Okay, you're hanging out at an 8, which means you only need 2 more of this like generic number that I'm saying to reach that threshold and send the message. So now that remaining 2, that could be somewhere, that could be a change in temperature, that could be a very small movement, that could be I rolled over in bed, I sat for 10 minutes, something that's not normally going to cause an injury now becomes painful because of that sensitivity. So basically, stress is going to increase that baseline level of electrical activity, bringing us closer to the threshold, which means we don't need as big of a stimulus to cause the pain to begin with. Okay, so that's one part of the problem. The other part, and this may surprise people, is that long-term high levels of stress can cause a change in our hormonal balance. And when I say hormones, I don't just mean reproductive hormones. I think a lot of people think that. So basically, it can cause an imbalance in those chemicals in our bodies. Anything that relates to, I'm diving in really deep here on the anatomy. So
good. Our people are pretty used to this, so that's great.
Good.
Thank you.
So the anterior pituitary gland releases a group of hormones, a group of chemicals. One of them is, it's adrenocortical corticotropic releasing hormone, which causes a release of cortisol, our stress hormone, right? Over time, when you have high levels of cortisol, the brain is going to detect that, and it's going to say, let's turn that switch off. We already have too much of it, so let's turn that off. So what we actually see traditionally in a lot of people with chronic pain is that they actually have abnormally low levels of cortisol. Okay, which is very surprising because we would expect people with all this fight or flight, we're talking about all this fight or flight and all this stress, we would expect them to have high levels of cortisol, but the opposite is true. Part of that is because of that feedback loop. The brain says, we don't need more of it, I'm going to turn it down. And the other thing that happens, the other part of that is that cortisol itself becomes depleted. Basically, the brain and the other parts of our bodies that create these hormones become depleted. Okay, so we see something called hypocortisolemia as one of the symptoms, I guess you could say, of having chronic pain. The other thing that's really interesting is any of the hormones that are released from the anterior pituitary gland are also depleted as a result of this, which is fascinating. When you look at the group of symptoms that are often associated with chronic pain conditions, they have to do a lot of times with these low levels of other hormones. So some of these other hormones are growth hormone, human growth hormone, some of our reproductive system hormones, so luteinizing hormone and follicle stimulating hormone in women. Those then will lead to a reduction or low levels of our reproductive hormones.
I want to go back to the growth hormone quickly. I mean, we know that for brain health, we need to have that human growth hormone. Without it, it's really hard to maintain cognitive function. So that's interesting that chronic pain, by reducing the cortisol, reduces that hormone as well. Wow.
Yeah, it is. It's super fascinating. And it kind of like the other thing too, that may also tie in with like our ability to heal, right? And so we're busy trying to heal our bodies when we're in pain, but that system may actually be inhibited in a way because of this whole problem. So it is fascinating.
So if somebody came to you initially with chronic pain, say, like, this is going to sound really weird considering I spend so much time looking after other people and I know so much about brain health. I've had a pain in my ear for 7 years. I cannot get rid of it.
Yeah.
And it's also accompanied by a certain degree of neuropathy from the trigeminal nerve. I've tried everything to get rid of this. If somebody like me came to you, what would you say?
I would say, you probably have some of the changes going on in the central nervous system and the peripheral nervous system. So that trigeminal nerve may actually have some of those sensitivity issues, which I think is in general, like what a trigeminal neuralgia is. But I would say you might have some other changes going on in the central nervous system, the spinal cord. Well, in the trigeminal nerve, there's no spinal cord involved, but you might have some changes in the brain. So there's some changes that we can actually go back and adapt. So one of the biggest changes I call smudging. Not sure if you've ever heard of smudging, but basically it's a change in the brain's map or the body map of that body part that's in pain. And it basically limits your brain's ability to correctly interpret those danger messages that it's receiving from down below. And when it doesn't know the information that it's receiving, it's like, I'm not sure what this is. That could be your ear, that could be your face. I don't even know if that is a face. I don't know what it is. When it doesn't know, it's safer for the brain to assume it's bad, it's dangerous, than it would be to say, oh, you're probably safe. It's probably nothing, right? Because if it's wrong about that, you could be, I don't know, something really bad could be happening. That could lead to tissue death or injury or something else, more severe, who knows? But so your brain, if it doesn't know, it's going to protect you. One of the ways it does that is by activating pain to let you know, hey, there's something here. I'm not sure what it is. It's scary. It's dangerous. It could be bad. So that's one of the things. So smudging is one thing. And then when you have pain for a long period of time, nerves, there's like a neural signature in our brains for that specific pain. Your specific nerve pain, your trigeminal nerve, is different. That neural signature is different than another person's neural signature. So no one's like if you were to look at an fMRI scan of someone experiencing pain, that looks different from every individual. There's no one brain region that's responsible for pain. Like we can't say, oh, the amygdala does pain. It's the whole brain, and it's different from everybody. And so those neural signatures themselves can get stronger and basically make those connections stronger. And I like to use the analogy of, when you learn something for the first time, whether it's tying your shoes or riding a bike or learning to drive stick shift, we don't just do that automatically the first time. It takes time to practice. The more you do it, though, it becomes so automatic that you get to a point, like for me with tying shoes, I couldn't explain to you how I do it. My hands just go. And if I had to slow that down and break it down and be like, oh gosh, I actually don't know how to do it, it's just automatic. There's muscle memory there. And the same thing happens with pain. Is the longer you practice it, the stronger those connections get. It gets to a point where the brain starts to learn how to be in pain. It gets really good at it. And the longer that exists, the harder it is to almost break up with it, the harder it is to beat that.
So that's why it's so important for people, if they do have chronic pain, don't just let it go. Don't just accept it, because then your whole life could be consumed by it, so to speak.
Yeah. And also it's a good thing to note, because a lot of folks, if the pain is provoked by pushing through a certain activity or just like, doing too much. But like with back pain, for example, a lot of people will just say, it's okay, I'm going to push through it this time. I need to get this done, and that causes a flare up. Every time we reinforce that flare up, we're reinforcing the strength of those pathways, thus making it harder to break up with pain. The same thing goes with, and this is another reason, going back to the physical therapy thing, when a physical therapist says like, just do more of the exercise that's causing more pain, we're not helping that person. We're doing the opposite, and if I think as PTs, and I'll get on my soapbox here for a moment, as PTs, if we can't recognize when our patients are not benefiting from an exercise in a certain amount of time, we need to stop and change gears immediately, because we're not helping, we're making the problem worse. In certain circumstances, if you had an acute injury, like you just sprained your ankle or you just fell and tweaked your knee, the exercises are more likely to be beneficial for that, right? But if it's a long-term issue, you come into me and you say, I've had pain for 10 years, I'm not starting with exercises. No way. So
what would you do? Smudge? I mean, I don't know what this smudging is, but is that what you would start with?
So that's a great question. We would start with, there's a lot that goes into it, because I don't think it's very straightforward, like just do this kind of thing. Part of it starts with building a foundational knowledge of what is going on in the nervous system, because if you're still really tied up in the belief of like, my disc is bulged, my muscles are weak, my joint is damaged, then it's going to be harder to understand why we need to do these drills to begin with. So in order to start the healing process, you need to really understand why you hurt. And a big part of that has to do with the nervous system. And so knowledge is a key part of this problem. And I will say this about learning the neuroscience of pain. I have so many clients who have just started that learning process and seen immediate changes in their pain without doing anything differently, without saying, I'm going to start doing this drill or this strategy. Sometimes for them, I'll give you an example of a client that I was just working with. For him, he'd been told his entire life, you have a bad back. You have a bad back, right? And that belief led him to move a certain way, to move in a protective way. It led him to believe that something was damaged. Everything was fragile in there. If he moved the wrong way, he could be paralyzed. And when he was able to learn what's really going on, why are all of these symptoms like this, he felt much safer in his body. And he didn't have to do anything different, honestly. Like he just started feeling better. In a week, he was like, I can't believe it. I'm at 1 to 2 out of 10. And a week before, he was in 10 out of 10 for months. So that knowledge is a huge component. And I think a lot of people might look at that and go, wow, that sounds really woo. And I get that it does sound really woo. Like what is that? But it's a thing, you know? And I think it ties into that fear, that fight or flight response.
That makes perfect sense. Yeah. Get rid of the fear. You can do so much, right? Because when you understand something, when you shine a light on it, it's not the boogeyman in the corner.
Exactly. Yeah. When you have the right kind of knowledge, you're more likely to feel safe. And yeah. And you kind of know what is safe and what's not safe, because he might have thought everything is unsafe for my spine. And now he's like, okay, I know what really is safe and what's not safe.
Alissa, this has been wonderful. Tell me how people can work with you. And I understand you have a gift for folks.
Sure. You can. I have a 16-week program for anyone who has chronic pain, regardless of your diagnosis, regardless of what you've tried in the past. It's going to dive into the knowledge of what chronic pain is from a neuroscience perspective and give you lots of tools and strategies to not only calm your nervous system, break out of that fight or flight response, but also retrain those pathways in your nervous system so that they don't continue to hurt you. The program is called the Chronic Pain Breakup Method, and you can get enrolled by either checking out my website or connecting with me on any social media platform at Pain Crusader. It's spelled just the way it sounds, Pain Crusader. And I do have a free gift. If you are interested in learning about, is my nervous system potentially causing some of my pain? Could my nervous system be hypersensitive? I have a free self-assessment that you can take that will give you kind of a score to say whether, yes, you do, or mostly your pain is probably structural and mechanical related.
Oh, that's perfect, because people don't understand. If you don't understand, how are you going to help fix it, right?
Exactly. So you can kind of figure out where you lie. And then in that assessment, if you do score on the side of, your nervous system is hypersensitive, there are some tips of things to try and where to start handling that type of an issue. And I will say this, I think a lot of people think that their pain is either one or the other. It's either structural, is it my degenerative joints or something like that, or is it my nervous system? It's not an either or kind of a situation. I would say almost all of the time, it's a little bit of both. And if you've had pain that's existed for a long period of time, that's resistant to typical treatment methods, like you've done the PT, you've done the injections, you've tried all of that stuff, and it's still not working, then there's probably a good chance you also have that nervous system component going on as well. So.
Gotcha. Thank you so much. This has been wonderful. I've learned so much in the last half hour, and I'm sure our viewers and listeners will as well. Alissa, I will make sure that all of your contact information is in the show notes. And I once again thank you very much for sharing your wisdom.
Yes, thank you, Kate. Thanks for letting me share my wisdom on your show.
Thank you so much for joining us for this episode of Brain Health Matters. Be sure to tune in next week, because Dr. Scott Saunders will be telling us what effect our dental health has on our brains. And if you want to stay up to date with all of the episodes as they're released, you can subscribe to Brain Health Matters on YouTube or your favorite podcast service. See you next week.